Hello, everyone, and welcome back to episode 59 of Your Birth Bestie podcast. Thank you so much for tuning in today. I am recording this the day before it's released, so today I am 31 weeks officially, which I still cannot believe. It is definitely true for me that at least with the more babies that I have, the quicker pregnancy seems to go, probably because I am home with my other two girls, pretty much doing something every single minute of the day, and I forget that I'm pregnant most days. But this last week, actually, I have felt super pregnant. My belly is popping for sure. Picking up my kids is hard. Household chores are getting harder. And picking up toys off the floor constantly all day long is the death of me. But thankfully, we are in this fun cleanup stage with my kids. They're actually really eager to help clean up all the things, do all of the chores. So hopefully that stays for a little bit longer. And I actually think it's because we recently and unexpectedly decided to move from our place in Heartland, Wisconsin to Waukesha, which if you are local, it's only like 15 minutes of a difference. But we are starting to pack very slowly, so I don't overdo it. But we are moving on the 1st of June. So my oldest, who is 4, is really excited about it and wanting to do all of the things to help. And then, of course, my almost 2-year-old is on board with whatever the big one wants to do. So overall, just a time of change, which is exciting, but also super busy. So we will see what the next couple of weeks will bring. And hopefully a June 1st move-in date is enough time before this baby comes in early July. But today, in honor of me, well into my 3rd trimester here, maybe you are too, I am not feeling miserable, but also I'm not super comfortable anymore. So want to talk a little bit about common 3rd trimester discomforts, how to manage them, hopefully help you get some relief, and also maybe just some solidarity that it's really hard being pregnant sometimes, and we are going to get through this. Hey there, I'm Beth Connors, a midwife and mom of 2, but also your birth bestie. In this podcast, we'll dive deep into everything you need to feel confident, prepared, and in control, from baby bump to delivery room, from practical tips to personal stories. We'll cover it all so you know exactly what to expect every step of the way. Let's get into it. As an overview of the most common 3rd trimester pregnancy discomforts that I'm going to be talking about, we have frequent urination, insomnia, swelling, heartburn, restless legs, and then also back, hip, combination of round ligament pain. These are so common, but also not super fun to deal with, in addition to your growing belly and probably everything else that is going on in your life. So helping you feel comfortable and maybe giving you a few ideas to get some relief is what I'm going to be sharing here today. So first is frequent urination, because if you're pregnant or you have been before, we have all been there. It can be so annoying to have to run to the bathroom literally every half an hour, but it is so important to stay hydrated, right? This has been something even my kids are joking about now to me, because it's usually them I'm asking, who has to go potty 100 times per day? But now my 4-year-old will ask me if I went potty before we leave the house, because by the time we make it anywhere, I usually have to go again, which isn't typical. They're not used to that. So staying hydrated is super important, especially as the weather is getting warmer. So unfortunately, drinking less so you don't have to pee is really the only way to stop this from happening, but also not something recommended, because dehydration can lead to preterm contractions, dizziness, lightheadedness, which, are all things that we don't want. My advice would be to anticipate how often you need to use the bathroom and prepare your day around those expectations, unfortunately. Same with at night, trying to get your water intake in during the day, and maybe then an hour or so before going to bed, trying not to drink too much more water so that when you do use the bathroom that last time before bed, you can hopefully get a pretty good stretch of sleep there. Which then kind of leads me into the next common struggle, being insomnia, or really just difficulty with sleeping in general during pregnancy. And this one is one of those things that is really unfair in pregnancy, that you would have a hard time sleeping, especially at the end of your pregnancy when your baby is about to be born and you're going to be then on their newborn wake feed and then hardly sleep schedule for a little bit, especially right after going through that marathon of labor. It just really sounds cruel, right? But as hard as it might be to prioritize sleep, truly trying your hardest to troubleshoot whatever is going on to make it the most comfortable and restful as possible is definitely worth it. We already talked about decreasing fluids before bed to help with those middle of the night bathroom trips, but finding either a pregnancy pillow or extra pillows around the house to support you in a way that is most comfortable throughout the night, I think is really the best thing that you can do to promote good sleep. My recommendation is for a pillow between your knees and then one supporting your back so that you can side sleep with that support of the pillow behind you. And then I also like to have something small, either rolled up or a really small flat pillow under your bump in the front. That under the bump pillow, I cannot sleep without and has definitely helped me with my round ligament pain that I was having to feel supported and not have as much pressure there and pulling from my round ligaments. Sleep can also be improved with exercise during the day, even something like gentle stretching, yoga, walking, light weightlifting. Whatever it is you can do to stay active will definitely help your body get more restful sleep during the night. We also recently bought another Hatch Rest sound machine, if you've heard of those, for babies, because each girl already has one of their own, so we're just going to get another one for this third baby. And my husband and I have actually been using it in our bedroom, and I've really been liking the white noise, and I think it helps with sleep too. And then the last piece of advice that I have is something that you probably already know about, and I myself am terrible at following with all of the work that I do at night after my kids go to bed, is practicing good sleep hygiene, which is not watching TV or looking at your phone right before you go to sleep. This is something I'm not very good at, but something that's really important to promote really restful, deep sleep. A warm shower or bath can also feel nice too, and something like lavender scented essential oils or lotions can also be good for promoting relaxation if you want to try something like that. The next thing I wanted to talk about is swelling during pregnancy. And I wanted to mention this because, yes, your belly bump is growing, but you also might start to notice some swelling in your ankles or your feet or your legs, your hands, maybe your face a little bit. This is because your blood volume increases by about 60% during pregnancy, and your uterus that is growing to accommodate your baby getting bigger is putting more pressure on large veins that their job is to return blood to your heart. So some of that extra fluid does not actually get circulated as well, and then will pool in your lower limbs, like your ankles and your feet, causing swelling. There are some tips to help, thankfully, because it can be uncomfortable for sure to have this little bit of swelling, but these are to take frequent breaks off your feet every couple hours or so. If you can sit down, put your feet up, even if it's for 10 minutes or so, just to give your body a break. And it's a way to use gravity to help those fluids get back into circulation. If you're not able to take frequent breaks because of your job, like for me, when I worked at the hospital and I was on my feet for 12 or 16 or maybe even more hours, I would always wear compression socks, which I absolutely hated putting on and absolutely hated taking off. But they saved me for sure, and my legs definitely wouldn't throb after a long shift at work, or at least there was improvement there. If they were a little bit sore, it definitely was not as bad if I had those compression socks on. Staying hydrated is also important to help your body not retain those fluids. So even though you may feel swollen and think that it's best to avoid drinking so much water because it will make it worse, it's actually the opposite. So prioritize hydration for sure, and hopefully your swelling will get better. On that note too, though, trying to avoid too much salt would be good because salt is something that will actually retain water and that will make your swelling worse. So something just to be aware of there. Things to just briefly mention though is that if you are noticing sudden swelling, or one leg or one hand is swollen but not the other, or your calf is warm or sore to the touch, these are possible concerns and something that I would definitely recommend you would want to mention to your provider right away. There are other conditions that can cause swelling that would be more serious than just, the usual pregnancy swelling that we're talking about. The next thing is heartburn, which is so common and a huge complaint for many moms because as your baby is getting bigger and your organs, including your stomach, are all being pushed up, there just isn't as much space for food. Also, there is this sphincter that's between your stomach and your esophagus that would typically work just fine, but during pregnancy with this added pressure from baby pushing everything up, it does not work as good as when you weren't pregnant. And this is where reflux or heartburn happens. You might find it helpful to eat smaller meals, but more frequently throughout the day. So you're not, reducing calories. You're just eating the same amount of food, but kind of breaking them up into smaller meals throughout the day. So it's more manageable. Also, avoiding foods that are spicy or acidic can be helpful as well. If you notice reflux is happening more at night, try eating at least 2 hours before bed, and then even elevating the head of your bed with pillows can help while you sleep. There are also medications available if it does become more severe, but at least these are a few options to try before that. And one thing that I have heard moms have success with is something called papaya enzyme that I haven't tried myself, but it's something to consider as well if it's, more severe that you're thinking about medication, but maybe you want to try something kind of in the middle, something that you might want to try before going that route. So just an option there. And then there are also 2 more things that I want to talk about. The first being restless legs, which I have recently started having myself too, as well as toe cramps, which I swear have actually led me to practice labor breathing techniques because the cramps are so intense. They are no joke. Restless legs usually happen at night, a lot of the times making it really hard to fall asleep. It isn't something that can be really cured, but to minimize maybe the severity or how often they happen, it's really important to stay hydrated, maybe trying calcium and vitamin D supplements. These can help with the management of those restless legs. I think it's also helpful to stretch or maybe take a walk before you go to bed to relieve that restless leg sensation. Massage is great too, as well as using heat or ice packs. I did buy a deep tissue massage gun and also one of those massage stick muscle roller things that have definitely made a difference for me. So definitely something that I would recommend trying as well to see if you would get relief from those. And then the last thing, and maybe the most common, is back and hip pain during pregnancy. In pregnancy, your progesterone levels are increased, which relaxes the joints and muscles in order for your belly and your uterus to grow. And also it makes your pelvis more flexible, so your baby can actually be more easily born vaginally, which these are all great things, right? But it can cause pain due to some of that instability. I have personally had low back pain and hip pain, especially since 2016 when I used to play basketball in college, and I had a hip injury that required surgery, which I fully recovered from and I felt great. But then when I got pregnant in 2019, and then, the next pregnancy in 2021, and then now when I got pregnant in 2023, they have always brought me just a lot of discomfort around my low back and my hips with just those changes in hormones. So not uncommon, but also not super fun to deal with. Plus your posture changes with more curvature in the lower back due to your belly growing and having more weight in the front. And then sometimes we just favor one side more than the other. That can lead to some unequal distributions of weight and compensation of muscles, and your body just gets irritated and sore. So thankfully there are a few things that can be done to manage and prevent these discomforts in pregnancy. And the first thing that is obvious and just even annoying to say, but preventing back pain by having good exercise and strength regimen before you get pregnant is obviously ideal. I feel like this is one of those, in a perfect world situations, but life gets busy. It's hard to sometimes prioritize those exercises, even though, yes, the intention is there. It's just finding the time and the motivation, just sometimes isn't. And I completely get it. My husband is a physical therapist, so I know what I need to do to maintain, pain-free or mostly comfortable, but do I do my exercises as often as I should? Definitely not. And I can feel when I don't do them, and I can also feel when I do them and I feel really good. So yes, prevention with exercise is great, but the next best thing, if that doesn't happen for you, are using a few other options. And let's talk about a supportive belly band that can go under and over your belly to take some of the weight off of your hips and your back. You can also use a yoga ball when sitting to help distribute the pressure. I really love sitting on my birth ball right now. It's super, super helpful for my hips and my tailbone pressure. Warm baths or heating pads on your hips, your back are helpful, as well as staying as active as possible, keeping that good range of motion and some flexibility and fluidity in the joints is really great for preventing and managing these discomforts. Gentle stretches are great, and finding a routine that you can manage every day will really just have so many benefits. So something that I am trying to prioritize as well, being 31 weeks pregnant and some days pretty miserable in terms of low back and hip pain. So knowing what I have to do and just really finding the time to do it is just so important. I also last week just started seeing a chiropractor because all of the above wasn't taking as much of the edge off as I needed to. Honestly, just to be a level-headed mom during the day with my kids, I was starting to get very irritable and letting that discomfort of my hips and my back affect how I was treating my kids, my mood, all of those things, that overall I just didn't feel good. So if you are local to the Lake Country area in Wisconsin, I went to go see Dr. Vanessa Fritz with Chiropractic Company in Oconomowoc, and she was so, so helpful. And I actually have appointments now scheduled weekly with her until I give birth to really just help align my body so that when I am able to stretch and exercise, I have more flexibility, less limitations, and less pain to be able to do some of these movements and make my body feel better when I'm not in her office getting those adjustments. So I definitely recommend chiropractic care in pregnancy, especially with someone like Dr. Vanessa, who specializes in pregnancy and has training using the Webster technique. Thank you so much for tuning in today for this episode on third trimester pregnancy discomforts and some more information to hopefully make this time a little bit more manageable for you. This is truly the home stretch before you finally get to meet your baby, and whatever mindset shift or support that you need to focus on that end goal, know these aches and pains are just temporary is such an important part. I am only 31 weeks at the recording of this episode, but I know as I get closer to 37, 38, 39 weeks and beyond, those days are so long. So if you're there right now and struggling, just a reminder that you can absolutely do this. You are going to meet your baby very, very soon, and I am wishing you all of the best. If you're looking for more support, please reach out on Instagram at BethConnors_CNM or email me at hello@bethconnors.com. I would love to meet you. I have an online birth course called Fearless Birth Academy to ensure that you are 100% prepared for a confident and calm birth experience, really reducing any fears that you have and replacing them with information and the ability to make the best decisions for you during birth. I also recently partnered with Mommy Care Kits, who supply pregnancy and postpartum support items to pregnant moms. I mentioned many of these items today, such as compression socks, a TENS unit, which I actually didn't mention, but as a side note, it's really great for restless legs and low back pain, a belly support band, leg compression devices to help with circulation, and then also a breast pump is something that is supplied as well. You have to apply through your insurance to see if you are covered. And I recently did this after learning about the program and was actually approved for all of the items. And I'm so excited to try them out and have them 100% covered by insurance. So something exciting I wanted to share and have a link below if you are interested in applying for free to see if you qualify. Thank you again for being here, and I hope you will tune in next Tuesday for another episode of Your Birth Bestie. Bye, everyone.